Hey, how about some aquatic therapy for healing? Well, we're going to find out about that because we are at Mountain Valley Rehabilitation Hospital with Karen Russell.
Hello.
This is a wonderful facility. I didn't know you had the pool.
Yes, we use it frequently for both our inpatient and outpatients.
Right. It may not just be recreation oriented. Apparently it's for healing, aquatic therapy. How do you define that, Karen?
Aquatic therapy is when physical therapy is performed in the pool under the direct supervision one-on-one with a licensed physical therapist.
Oh, okay. Yeah. And what kind of benefits does aquatic therapy, the aquatic life, aquatic therapy, what does that offer people?
Yeah, one of the key things is the buoyancy of the water. For a lot of individuals, they can't tolerate weight-bearing, land-based activity because of severe pain. It could be back pain, arthritis. So the buoyancy of the water supports their joints so that they can exercise in a more comfortable setting.
Okay, now does that have to do with like the weight-bearing and the non-weight-bearing kind of a thing? And is there a difference between those two things?
Yeah, one of the things I always emphasize when it comes to water therapy is it is a great venue for, again, for exercise for individuals that have a lot of pain, but what you don't get is any weight-bearing. So individuals with osteoporosis and they're looking at challenging their bones and strengthening their bones and preventing or decreasing their chances of osteoporosis, they're not going to get that as much in the pool because it's more of a very non-weight-bearing, limited weight-bearing activity because of the buoyancy of the water.
So it's much more protective for them. And so, but it's not just for like older conditions. What kind of people and conditions do you deal with that maybe are, you know, not age-related?
Right. We can deal with anybody in the pool. The pool is about 4 feet deep, so it's very safe for most individuals, and it could be anybody recovering from surgery. So it could be a knee surgery, a hip surgery, it could even be an upper extremity surgery, anybody with chronic pain. So it's a really great way to exercise if you have chronic pain.
All right, what if people don't swim? Can they still do aquatic therapy, Karen?
If you don't swim, it's very, very safe. Again, because it's only maybe 4, ours is 4, but they'll range anywhere from 3.5 to 4.5 foot deep. So you're very, very safe. And the other part of it, when you are getting the one-on-one therapy, you're going to have a therapist that's actually in the pool with you the entire time. So it is extremely safe.
Fabulous. Well, of course, this is Mountain Valley Regional Rehabilitation Hospital in Prescott Valley, but other than this, where do people go for aquatic therapy, Karen?
Yeah, it's important to call because not all hospitals have a pool. So it's important to call to see what they have and also what the temperature is of the pool, because depending on what exercise you're doing, that's going to dictate what kind of a pool and what temperature you want it to be. The higher the intensity, like lap swimming, you want maybe 78 to 82 degrees, but if you want something more low intensity for therapeutic reasons, it's going to be in the 90s.
Okay, because this is warm in here. It's warm in the air, warm in the water, which you said is good because then when you come out of the water, you don't get chilled and that kind of
because
thing.
then it's going to be kind of counterproductive. All that wonderful therapy you got where you warm the muscles and you warm the joints, if you don't come out into a nice warm environment, it's pretty much all mute.
All right, and in 30 seconds, how about safety features of aquatic therapy?
Safety features, so again, you're looking for the right temperature of the water. You want to make sure that maybe they've got some type of supervision. If this is a general type of a pool, you want to make sure that there's steps to get in. You want to make sure there's a rail. And for emergency purposes, it's really good to have a lift. So if for some reason they need to get somebody out fast, it's good to have a lift to help keep people in and out safely.
Well, I think this is going to be really fun, Karen. So I think I'm going to go for some aquatic therapy. What do you say?
I think use those weights, get some resistance, get some strength. We're good to go.
Thank you, Karen. All right, more fun right here. Arizona Daily Mix.